Thank you very much, everyone, and good afternoon, good morning, good evening, wherever you are. I'm Gary Hickey, and I'm a Senior Public Involvement Manager for the Wessex Institute, University of Southampton, and I'm also a Patient and Public Involvement Lead at the Research Design Service in the South East. So basically, I give advice and guidance on patient and public involvement. And before I go on, Katie, just want to say a few words about yourself?
Thank you, Gary. Hello, everybody. It's brilliant to be able to be here and spend time with you. My name's Katie. I work as a survivor researcher in mental health at St George's, University of London. I'm also a lay reviewer, so I review research proposals from the perspective of public and patient involvement. Thank you, Gary.
Thank you. Okay, so our presentation, we've titled it Patient and Public Involvement in Research in the UK, Getting It Right, ? So next slide, please, Ollie. Thank you. And the aims of our presentation is that I'm going to put forward a case for success in the UK, and then Katie's going to identify the flaws and where we can improve. And can I just say, for the benefit of everyone listening, that I am partly playing a role in putting forward the case for success, and I'm doing that really in order to set up the debate and provoke discussion. So please don't hate me too much. Next slide, please. So I'm going to argue that patient and public involvement in research is firmly embedded in the Commission of Research in the United Kingdom. Not only that, that patient and public involvement in research is firmly embedded in the culture and the process and procedures of the organisations who undertake research, such as universities. And finally, my third point is the direction of travel is for more deeper patient and public involvement. So when I talk about the direction of travel, this is where we're heading with patient and public involvement in the UK. Next slide, please, Ollie. So what I do want to do is just make sure that we're all on the same page, and so you know what I'm talking about when I'm referring to public involvement. And in the UK, we distinguish between involvement, which is research being carried out with or by members of the public rather than to, about, or for them. So this would be, for example, members of the public helping us design research proposals, for example, or indeed helping us to design research questionnaires and other research instruments. So we're not actually collecting data. I'm just very aware that in some countries, indeed South Africa, for example, and Canada, you refer to engagement when we talk about involvement. And that's distinct, of course, from participation. And this is where people take part in a research study. So this is where we actually collect data from people as they fill in our questionnaires. And just to be clear, I'm talking about involvement today. Next slide, please, Ollie. So first of all, I'm going to talk about patient and public involvement is firmly embedded in the research commissioning process. So what's my evidence? Well, for a start, increasingly, if you don't have patient and public involvement in your research in the UK, it's very, very unlikely that you're going to receive any funding. So my own organisation, the National Institute for Health Research, says how you've involved patients, carers and the public will be assessed when your research application is reviewed by our prioritisation and funding committees. And indeed, there's members of the public on those funding committees. In addition, the Health Research Authority will review how you're involved and engage members of the public when it assesses your research for ethics approval. And it's the Health Research Authority that gives or indeed denies your research ethical approval. So it's quite clear there that you do need to involve patients and the public in your research. I'm sure some of you are thinking, well, Gary, you've proved the point, you can end there. However, I've got more evidence for you. So next slide, please, Ollie. In the United Kingdom, we've actually developed some standards for public involvement, and they're on this side here. There's 6 standards: communications, governance, impact, support and learning, inclusive opportunities, and working together. Now, these standards can help you guide the public involvement in the development of your research proposals and indeed the undertaking of your research. They're also used by commissioning and funding panels to assess your patient and public involvement in your research studies. So everybody, from the commissioners of research to people undertaking research, are singing from the same hymn sheet. Researchers know what they have to do, and commissioners and funding panels have criteria by which they can assess the quality of those research proposals and indeed the impacts of that research. Next slide, please, Ollie. So that's commissioning side of things taken care of. I've clearly proved my case. I'm now going to move on to research organisations and talk about how I think patient and public involvement is firmly embedded in research organisations. So in the first instance, many universities, for example, that undertake research often already have a patient and public reference group. And these patient and public reference groups help shape research strategies, help develop research proposals, and help researchers to actually undertake research. And these universities and other research organisations usually have well-established policies and processes for paying patient and public for their involvement. And obviously that's absolutely vital to show how much people are valued and to keep them involved and show how important patient and public involvement is. Researchers are aware of and receive training on patient and public involvement. All researchers qualifying today that are coming through today will have been made aware of and received training on patient and public involvement. So it's firmly embedded in the culture of our research organisations. And finally, there's a range of organisations, including my own, the Research Design Service, that can provide advice to universities and researchers from universities and other indeed research organisations who are seeking to involve patient and the public in their research. Next slide, please, Ollie. Now, this is possibly a slide that might get me into trouble because I'm sure that I plagiarised the work of many people, including my own. But anyway, I'm going to persevere. So I think I've clearly shown that patient and public involvement is firmly embedded in the culture and processes of the research funders and research organisations. Now I'm going to give you even more good news when I talk about the direction of travel for patient and public involvement, basically where we're heading. So in this, this slide, which I've grandiosely called Hickey's Power Continuum of 2020, across the middle there, you'll see 5 different approaches to involving patients and the public. And a way of distinguishing between these 5 approaches, from information to service and user-led research, is to consider the amount of power that patients and the public have in decision-making. And the further to the right of this continuum, i.e. to the co-production service user-led end of the continuum you are, then the greater is the shift of power towards patients and the public in decision-making. And I'm going to suggest to you that the direction of travel is towards the right end of this continuum, i.e. towards co-production, service user-led research. And it's what, if you like, we call a democratization approach, where the key rationale is to democratize decision-making in the development, delivery and design of our research. So the shift in power and decision-making towards patients and the public, away from a consumerist end, which is more about consultation and information giving, where the approach is much more driven towards improving the quality of our research products. So I'll just take you briefly through this continuum. So back in the day, many years back, we just had information given. So we used to tell patients and the public what research we were doing. So they weren't involved in any way at all. We would basically give them information, so there's no power shift. We then started to move towards consultation, where we asked patients and the public their views, for example, on the questionnaires that we were developing, perhaps on the research proposal. But it was still up to the researcher to decide whether or not to take those opinions on board. So there's no real shift in power. We then start to move towards collaboration. And here we work much more in partnership with patients and the public. So there is a real shift in decision making. So here, for example, we might include patients and the public in the development of a questionnaire, and they would have an equal voice, equal power to that of the researcher and indeed other people in the room. But it still tends to be researchers who decide which areas of the research process that patients and public can be involved in. Moving further along the continuum, we have co-production. And here there is joint ownership of a project. So it's collective decision making about who is involved in what and who has how much power in what issues around the research. So the real shift in power. And finally, we have service user-led research. And here it's members of the public or representatives who clearly own and control and direct the research. And I think the future lies in the right-hand side of this continuum. Co-production is definitely having its moment right now in the UK. My organisation, National Institute for Health Research, and Doreen noted this earlier, has developed some guidelines on co-production. There are centres of co-production in the UK, and indeed just last week we had a co-production week where we celebrated all things co-production. I think you can argue that this sort of taps into a wider movement, if you like, a wider environment around civic engagement. So, for example, there is a civics universities movement in the UK, where universities are being encouraged to develop a civic role and engage with and develop relationships with their local communities, including the co-creation and the co-production of research. So next slide, please, Ollie. So in conclusion then, I've tried to demonstrate that patient and public involvement is firmly embedded in our research processes and the culture, both in terms of commissioning bodies and organisations undertaking research. Without any meaningful patient and public involvement, we won't receive any funding. And finally, I think the direction of travel is much more towards the democratisation of research, where patients and the public are firmly embedded and involved in decisions about the research process. Thank you very much. And over to you, Katie.
Thank you, Gary. Well, hello, everybody. Gary has made some very valid claims in a number of very important areas. However, I would like to raise some questions and concerns around these. So Gary, yes, I agree. I think involvement is well embedded in the commissioning process. I am actually a lay reviewer, as I mentioned, and I look at research proposals and the involvement planned for a research project. And it is a really important part of the decision about whether to fund a project or not. But, and there is a big but, my questions are, how do we know that what is intended in terms of involvement has actually taken place? And by that I mean, where are the processes and structures for demonstrating that involvement has taken place? Now, I do acknowledge that often on many research projects and streams, that the funder does ask for a report on involvement at interim stages. But I think the onus is on the grant holder to provide this rather than the funder to ask questions. And I have another question. Where is the accountability if things don't happen as planned? And I'm really keen to say that for me, this isn't about being judged, about whether you've done something right or wrong, but rather having a structure which enables us to reflect and learn from how things have been. Ollie, could I have the next slide, please? Thank you. Gary went on to say patient and public involvement in research is firmly embedded in organisations undertaking research. And I work in one of those such institutions, a university. And for me, this is a valid question to ask. But is this really the case? I think we have a huge variation in our approaches to involvement. And while I think this creativity and innovation is really key, I also feel that these different approaches can lead to different interpretations of what we mean by involvement. I also feel in recent years there has been a move towards lumping a lot of terms together when we're talking about involvement. Gary touched on this, and I think members of this webinar have already brought this up, and maybe we can discuss it further. But for example, involvement, engagement and participation all mean very different things to those of us working in the field in this country. I acknowledge it also means different things to people working in different countries. But I do think that bringing all these terms together can blur the distinction and muddies the waters. I think there are pockets of great practice, but I also think there are areas where involvement just simply doesn't happen, or it's a very much a tick box exercise, or even worse, it happens, but it's done badly. Gary mentioned training. Well, I know for a fact that training in involvement for researchers doesn't always happen. And so knowledge levels around involvement vary enormously. I'll take one example that Gary mentioned. For instance, payments is still a very thorny issue. There's still very many systemic barriers which make it very difficult for people who do involvement work to be paid in a clear and simple way. They often have to jump through many hoops, and access to advice is often lacking. I also would add that I don't think that strategic and organisational embedding of involvement is that widespread. For instance, in my experience and of my colleagues, often you have individuals who initiate great things around involvement, but unless that host institution embeds this in their strategy and has processes for these initiatives can often die away when, for instance, that individual moves on to another post or individual. Now, I'd just like to say that I think there's many things that are key to embedding involvement in organisations, and I'd just like to focus on two, which I think we could really, really improve on. And that is the issues around diversity. We are quite hopelessly underrepresented for Black and minority ethnic communities, and also those communities which are often described as hard to reach. And I think this is an indication of our lack of diversity. I would prefer to describe those people that are hard to reach as seldom heard, because I think that puts the onus on the institutions to change rather than the people that we're trying to involve and engage with. I also think we need to work hard at creating safe spaces within research teams and institutions so that we can establish that culture of reflection and learning around involvement. And so often that doesn't happen. Next slide, please, Ollie. Finally, Gary talked about the direction of travel, saying that it's leading towards deeper patient and public involvement. I would really love to believe this, that we're heading in the right direction, but I do question this. And this is to do with recent events around COVID-19. I think we can agree that when resources are stretched and time is short, involvement and meaningful partnership working is often the first thing to disappear. When decisions have to be made quickly, it's often easier and quicker not to involve the voice of lived experience. And I think it's very true to say, and there have been a number of articles and things written recently, that this is exactly what's happened in the first weeks and months of this epidemic that we're now facing. And in a time of sort of massive worldwide uncertainty and threat to our mental and physical well-being, I think this lack of involvement can have really devastating effects. Next slide, please, Ollie. So in conclusion, so yes, I think we have come a long way. I first started working in involvement in sort of service development back in the 1990s. And then in involvement in research in 2005. And I think we have come a long way, but there is still much work to be done. We really need to have a cultural and systemic change. Key in that is we need to be more diverse. I think particularly universities in the UK still have a very narrow demographic, especially those who occupy positions of sort of responsibility and power. We need to make sure that in times of emergency and threat that the lived experience voice is stronger than ever and doesn't decrease. And finally, I'd say that a universal buy-in and commitment to working in partnership involves both the devolvement and giving up of power. And I think this is a huge challenge that we still quite haven't achieved yet.